Birth Story 9. I heart my epidurals. Mom. She loved her epidural experience with her first baby and wanted to be guided through labor until she was ready for her epidural again. Achieved a vaginal medicated birth with IV fluid epidural. Baby number 2, Parker, born July 10th, weighed 6 pounds, 8 ounces. Gestation, 39 weeks, 0 days. Labor. She was in prodromal labor for 2 days. Natural onset of labor lasted 15 hours, and she pushed for 19 minutes. Dear Parker, your mom called me in the middle of winter and told me that she was pregnant again and due the next summer on July 17th. We kept in touch throughout the winter and spring, and then your mom began early labor signs on July 8th. She called me on Saturday morning at 2:30 a.m. to let me know she felt like she might be in labor. I told her to ignore everything. I urged her to try and sleep. Your mom was able to sleep and rest throughout the night and the next day. Contractions were present and slowly building, but consistently 15 to 30 minutes apart. The cramping was just enough for awareness, but not enough to call it labor. By the time your big sister went to bed on Saturday night, your parents knew that you would be arriving soon. At 10:30 p.m., her contractions had started to pick up. Your mom took a hot bath and drank a small glass of wine to help relax. When she needed active support for her surges, she planned for me to be there. I told her to keep resting and to call me when that became impossible. That impossibility happened at 12:30 a.m. on July 10th. Your dad said to come right away and that things had really started to progress. I arrived at your home around 1 a.m. and found your mom in the living room. The room was dark and your grandma was sitting on the couch helping your mom in labor. Your dad was very excited and concerned. Contractions were 4 to 5 minutes apart, and she was having trouble getting comfortable. She labored hanging over the chair in the living room for a while. Then she contracted on her hands and knees over the couch. Within an hour after I arrived, she decided it would be best to head to the hospital since she knew she wanted an epidural. She had a great epidural experience with your sister and wanted the same experience again. Contractions slowed down during the transfer to the hospital. Your mom had 3 contractions during the 20-minute car ride. When we all arrived at 2:30 a.m., they took your mom into triage. She did not want to sit on that bed in triage. The hospital policy was to monitor her contractions and your heart rate for at least 20 minutes, just to make sure everyone was healthy. Your mom was so funny and kept asking how many more minutes were left. She eventually said, "I'll sit here for 3 more minutes and then I'm out of here. I don't care if they say it's okay or not." I couldn't blame her. It is so hard to sit still in labor, but it is also quite important to monitor you. They couldn't determine if your mom's water had broken. This is still a mystery to me because there are so many confirmation tests available. Pop out tests for confirming water rupture. Your provider can diagnose your water as being ruptured in multiple ways. Number 1, examine fluid coming from the vagina. Number 2, order a pH test for a sample of vaginal fluid, since amniotic fluid has a much higher pH than vaginal fluid, usually 7.0. Number 3, Perform a litmus test with nitrazine strips, which will change color if the pH is greater than 6. Number 4, view droplets of fluid under a microscope for ferning. When you zoom in on amniotic fluid with estrogen, you will see a fern-like pattern. Number 5, utilize the AmniSure ROM test to detect the PAMG1 protein marker in vaginal discharge. Your mom said that she had leaked a little bit of fluid throughout the day, but that nothing major had come out. They checked her cervical dilation and she was 3 to 4 centimeters. We took our time walking down the hall to the room, and as we passed another young woman in a short purple robe, your mom said, "Geez, I really have to get it together. She is way calmer than I am." I looked at your mom and said, "She already had her baby." Your mom's contractions were now 2 to 3 minutes apart. When we arrived at the birthing suite, the nurses had already drawn a warm bath for your mom. However, she was not interested. Your mom was not going to sit down, not even for a bath. This labor was unfolding so differently than your sister's, where we couldn't get her out of the bathtub. She was finding comfort in the contractions by leaning forward on me and your dad. A little tiny bit of fluid leaked out on the floor, but they still were not convinced her water had broken. Your mom said that these contractions and the car ride were just way more intense than with your sister. She was still laboring naturally to try and progress as far as she could before the epidural. Once everyone and everything settled into the room, your mom started to tire. She had been in prodromal labor for more than 48 hours and active labor for 8. Your mom said to your dad, "This is it. This is our last child. I am not doing this again." She changed her mind as soon as you were born, and you have a baby brother. It was now time for her epidural. Her cervix was 5 centimeters dilated. The nurse called for the anesthesiologist, and they gave your mom 2 bags of IV fluids. Pop out IV fluids for blood pressure. One of the most common side effects to epidural anesthesia is a significant drop in blood pressure because it is a vasodilator, which relaxes and dilates blood vessels and allows blood to pool in your legs. In order to prevent this drop in blood pressure, many hospitals will preload IV fluids, which act as a vasoconstrictor. If you already have hypotension, low blood pressure, then you are at a higher risk. But half of all laboring women will experience a drop in blood pressure, regardless of IV fluid preloading. Symptoms may include blurred vision, feeling weak or faint, and garbled hearing. This pressure drop can also affect the baby's blood pressure. If your blood pressure drops severely, you may be given more IV fluids, ephedrine, which is adrenaline, and oxygen. IV fluids are also given routinely in labor to prevent dehydration. The anesthesiologist came in around 4:30 a.m. Within 20 minutes of the epidural being placed, your mom started to feel more comfortable and she was able to rest. She continued to rest her eyes and I rotated her from side to side, but she was too excited to fall asleep. Your dad, on the other hand, was snoring in the Murphy bed. At 8 a.m. after shift change, the doctor came in to check your mom's cervix. She was 5 to 6 centimeters, significantly more effaced, and you were moving down. Your mom continued to rest and roll from side to side while laboring. At 10 a.m., your mom announced that she thought she had to go poop. This was pressure from your head coming down. She didn't actually have to poop. Her cervix was almost fully dilated. She didn't yet have the full urge to push you out, so the doctor suggested that we let your mom labor down slowly. Pop out, labor down. Laboring down is practicing the art of patience and listening to your body. Your cervix might be complete at 10 centimeters dilated, but your baby's head may still be high and not engaged in your pelvis. An example might be a -1 or -2 station. If you progress to 10 centimeters without the overwhelming urge to push, natural, or overwhelming pressure in your rectum, epidural, then just wait as long as your baby is doing okay. Albeit, sometimes with an epidural, you may never feel the contractions or pressure that you need to effectively push. In these cases, your providers should turn down your epidural medication until some feeling resumes. Eventually, those feelings will come. If you have an epidural, rest and sleep until you feel these sensations. If you are laboring naturally, the ejection reflex will trigger. Until then, it is a good time to get some final squats in. Your pushing may be shorter and more efficient after laboring down and listening to when your body says it's go time. At 11:20 a.m., your mom said, "I think I have the urge to push." She couldn't feel her contractions per se, but she could feel the pressure and the urge to push when the contractions peaked. She said it felt like so much pressure, as if she had to poop with a bit of an urge to push. The doctor checked your mom's cervix again, and she was completely dilated, and your little head was very far down. An interesting part of your mom's labor was that her water was actually ruptured, but she never experienced that pop or a gush. The doctor suspected she had a small tear and was slowly leaking fluid for weeks before your delivery. Your mom started to push at 11:30 a.m., and from the first push, your dad and I could see the hair on your head. Parker, you arrived into this beautiful world at 11:49 a.m., weighing 6 pounds, 8 ounces, and measuring 18 inches long. Your umbilical cord was short, but they still let your cord completely stop pulsating before your dad cut it. You had to rest on your mom's lower abdomen instead of her chest to help the cord drain. Your mom breastfed you immediately after you were separated. You had a little bit of jaundice, which is a high level of bilirubin, creating a yellow pigment to your skin and yellowing of your eyes. Pop out, jaundice. 3 in 5 babies, 60%, are born with jaundice. While there are many root causes, this occurs because newborn livers are not yet fully mature and are less efficient at processing and eliminating bilirubin from the bloodstream. They wrapped you in UV light therapy for support, which made you look like a cute glowworm. Then your parents spent time with you at home in indirect sunlight until your jaundice was clear. Much love, your doula, Heidi. Reflections. Jot down your thoughts about this story.